Hello everyone. Welcome to the AVPN webinar on blended finance, accelerating innovations, enabling equity. My name is Isha and I am the Officer Platforms at the Asian Venture Philanthropy Network, India. AVPN is a unique funders network committed to building a high-impact philanthropy and social investment community across Asia. Currently, we have over 600 plus members across 59 countries. Before I let Naina Batra, CEO AVPN, go ahead and introduce the speakers with us on the Fire Chat today, a few housekeeping instructions. Please feel free to introduce yourselves on the chat box. We will not be taking any questions during the discussion, but will open up the floor for Q&A after the speakers have presented. Please feel free to use the console to type in your questions in the Q&A box while the speakers are presenting, and Naina will raise the questions to our speakers thereafter. In case you have any questions, please ensure that you're posting it via the Q&A box and not on the chat box. Please ensure as much as possible to address your questions to specific speakers. We will launch a poll for 30 seconds for which we request you to participate so that the panelists get a better understanding of the audience. We request all the attendees to kindly stay with us for an enriching discussion. The recording of the call will be shared with all. With great enthusiasm, I will now hand over to Naina to take this ahead. Over to you, Naina.
Good afternoon, everyone. A very warm welcome to all of you. As Isha mentioned, my name is Naina Sabarwal Batra. I am the CEO and chairperson of AVPN, and it is my honor to join you as the moderator of this webinar from Singapore. Our topic today is something which is not only timely, but is extremely relevant. Accelerating health innovations and innovative financing models for improved health outcomes. India, as we all know, is home to 1/6 of the world's population, but it actually has a very underfunded and overstretched healthcare system. The total government expenditure stands at only 1.2% of GDP, which is significantly below the global average of 6%. In the recent past, there has been a conscious and steady policy shift in India from a selective healthcare approach to a comprehensive primary healthcare paradigm, along with notable improvements in maternal and child health indicators. The Ayushman Bharat program, one of the largest public healthcare schemes in the world, envisages the provision of free healthcare to more than 500 million people and the operationalization of over 155,000 health and wellness centers provide CPHC for the primary healthcare provisions. However, the recent outbreak of the COVID-19 pandemic has exposed huge gaps in the healthcare delivery systems, both public and private, at different levels, and it has re-emphasized the need for innovative solutions. Without swift and decisive action to strengthen health systems, the social and economic dimensions of this crisis can cause financial and health access inequity in our society to rise even further. Addressing the challenges would require innovations in financing mechanisms that go beyond replicating traditional health financing models. A new age of social entrepreneurs is also responding to these challenges with market-based solutions and sound business models that are aimed at achieving both social impact and financial sustainability. Such enterprises require an empowering ecosystem to confront these challenges due to slowing demand. Can I request anyone else who's on this to mute themselves, please? Thank you. So, as I was saying, these social enterprises require an empowering ecosystem to confront challenges due to slowing demand, supply chain disruptions, and limited access to markets and capital. There is a great opportunity here. There is an opportunity to achieve the goal of universal health coverage, which actually requires closer partnerships between the public and the private sector that will create this enabling environment that can actually nurture enterprise, that can assure social impact as well as financial sustainability. To generate this kind of transformative impact at the ground level, it is imperative for government, corporates, funders, social enterprises and innovators, as well as non-profits and charitable organizations to come together to work cohesively rather than in silos. And that is why AVPN has seen it as its responsibility to try and convene these different players along what we call the continuum of capital to bring together innovative financing solutions that can be deployed to unlock new pools of capital and shift the risk-reward mechanism to drive greater efficiency and social impact. We believe that this can go a long way in addressing the estimated US $305 billion funding gap for achieving the health SDG goals in India. So to address these challenges, we have partnered with the USAID through their Pehel Health platform. This platform aims to galvanize shared value partnerships, to promote innovative financing mechanisms, and to disseminate learnings among stakeholders to address the challenges faced by health entrepreneurs as well as private funders. Keeping this background in mind, I am extremely excited to welcome my two esteemed speakers today. Our first speaker is Dr. Indu Bhushan, who is the CEO of Ayushman Bharat, the Pradhan Mantri's Jan Arogya Yojana, and the National Health Authority, Government of India. Dr. Bhushan is an ex-Indian Administrative Service Officer of the Indian Civil Services, 1983 Rajasthan Cadre. He holds a doctorate in health economics and a Master of Health Sciences from the Johns Hopkins University in the United States. He is an alumnus of the prestigious Indian Institute of Technology, Banaras Hindu University, and IIT Delhi, where he completed his BTech and postgraduate diploma respectively. He is also a chartered financial analyst. Dr. Bhushan served for 9 years in the IAS prior to leaving government service. Thereafter, he worked as the senior economist with the World Bank Group prior to moving to the ADB. Along with Dr. Indu Bhushan, I have a great pleasure in welcoming Mr. Edgar D. Kagan, the Deputy Chief of Mission for the United States in India. Mr. Kagan assumed the position of Deputy Chief of Mission in New Delhi after serving 2 years as the US Consul General in Mumbai. He served previously as the Deputy Chief of Mission of the US Embassy in Malaysia, the Deputy Director of the US Mission to the UN's Washington office, and as Deputy Assistant Secretary in the Bureau of East Asia and Pacific Affairs. A Foreign Services Officer since 1991, he served at US embassies in Australia, China, Israel, Hungary, and the Ivory Coast. Mr. Kagan has also served as the Director of Korean Affairs and has had tours of duty in the Office of Chinese and Mongolian Affairs, as well as on the policy planning staff. A very warm welcome to you, Dr. Bhushan and Mr. Kagan. Before we start the webinar, I'm going to now conduct a poll. So can I ask the AVPN team to put the poll up, please? Okay, I think we can close the poll now. Great, so we have a lot of implementers in the room. We have almost 200 participants that have joined us today, of which 53% are from an implementation or a consulting agency. 10% come from policy or academia. 10% see themselves as entrepreneurs or innovators. And 27% are investors or grant makers. So I think it's a good mix of people providing capital as well as those actually doing the hard work on the ground. So welcome everyone to the webinar. So I'm going to start this afternoon with a question to Dr. Bhushan. My first question to you, Dr. Bhushan, is how has your journey been thus far at NHA? And how has it been different from what you perceived it when you took up this key responsibility? It's not really a simple question, but I'll ask it anyway. Dr. Bhushan, will you unmute yourself? Sorry.
Thank you very much, Nana. Thank you for having me on this panel with Mr. Kagan. great pleasure for me. Yes, indeed, the journey has been really very fascinating. I came back to India after about 27 years. I was in the US for 5 years and then 21 years for in Manila. And before that, I was in the IAS. So in a sense, it was like homecoming, coming back to India, coming back to government, and coming back to the health sector where I started. And when I took up the job, I knew that it was a very challenging job, but I didn't realize the scale of challenge because it was not just one scheme. We were dealing with almost 36 different schemes because health is a state subject and every state has its own mind that it should have. And so we were dealing with each and every state and negotiating with them. And so getting all the states together, convincing them that they should be part of Ayushman Bharat, and at the same time creating a backbone, IT backbone, and also the ecosystem for this scheme was a challenge. And at this, on top of it, we were giving 6 months, only 6 months to implement the scheme, which had more than 500 million people to be served and thousands of hospitals to be brought on board. So of course, we didn't have too many nights where we slept for 8 hours, but we were pleased to have a very smooth rollout. And just to give you some sense, we are completing almost 2 years, maybe 2 months less than 2 years, and we have provided more than 100, more than 10 million, 10.1, 11 million treatments, and we've spent about $2 billion on this. We have more than 23,000 hospitals on board. And as this country in the world is going through this crisis, I'm very pleased to say that our efforts, both in terms of creating IT infrastructure, as well as creating this network of hospitals and a scheme which can serve the poor, has come in really handy. So these 2 years have been fascinating in the sense that they've taught me a lot. They've given me an opportunity to work with the in the sector that I love to work in, and for the people that I care about. So it's very gratifying also to see the results of all our efforts last 2 years. So if I'm offered this job again, like to go back 2 years, I would do it all over again. No, no regrets.
Wonderful. Great to hear that. And, you thought the first 2 years were a steep learning curve, and then you were thrown googly in the form of COVID. So, I will come back to ask you more about how you managed to face that particular googly. But coming to you, Mr. Kagan, you've actually been in India for 3 years. So, I'm going to ask you a similar kind of question. What is your impression about India? It's personally, I think 3 years is too short a time to have impressions about a country as diverse as India. But I'd love to hear from you.
Thank you so much, Naina. And thank you so much, Dr. Bhushan. It is a great honor to be here, and obviously to the Asian Venture Philanthropy Network. Thank you for the organization of this. I think it's particularly timely. Look, I mean, your question is exactly right. I mean, who can understand a place like India in a lifetime? I mean, most of the Indians I know are very quick to say how much of India they don't know and don't understand. So as a foreigner, it's particularly difficult. I think that, I've also had the good luck of having gotten to experience it first in Mumbai and then in Delhi. And I think that it is very valuable for those of us who have the pleasure and the privilege of serving in Delhi to have actually spent time outside of Delhi. Because I think that one of the things that is the most interesting about India is not just the diversity, which is a sort of cliche, but obviously true, but also the vast difference between how states operate and the difference between the state policy at the state level and at the center. As an American, I think that we are probably a little bit more equipped because that's how our country functions. But still, the complexity of the relationship between the states and the center, and also between the states themselves, is fascinating. What has struck me about India is the energy and the creativity. I mean, there are so many incredibly bright, incredibly capable, really creative people who are doing so much here. the potential is extraordinary. You know, I've had over the course of my career, I have tried to go to places where I thought history was happening. I studied history, and so, you know, I thought that that was sort of what I wanted to do with my career. And so I've served in Eastern Europe in the early and mid 90s. I've served in Israel at the time of the negotiations with the Palestinians in the late 90s. I served in China and spent much of my career working on China directly or indirectly. And so, and now being here, what I see is the potential is so extraordinary. At the same time, the challenges and the needs are extraordinary. And I think that what I envy Dr. Bhushan is that he is working on something that is truly extraordinary on a global scale. I mean, nobody is doing something at this level of scale with this level of challenge. And, you know, inevitably being in a place where that's happening gives you tremendous insights into the potential that the country has. I think that the needs include capital. And what I find fascinating is I think India has tremendous potential to basically leapfrog much of the rest of the world in this area of essentially venture, philanthropy, and innovative financing. And I think that, you know, what I love about this is that we're looking at something that, you know, has the tremendous potential to improve lives in India, but also, like so much what's happening here, of being a template or model that is applicable in many other parts of the world.
No, absolutely. And I think, you know, it's interesting when you said that, you know, you do envy Dr. Bhushan in terms of what his job affords him in terms of achievement at scale and the kind of opportunity to impact lives at scale. And, you know, also I think Mr. Kagan, your point on, you know, India can be a really great exporter of models that work at scale. And, you know, exactly, I think Ayushman Bharat is a very good example of that. If, you know, if and when, you know, not if, but when it does get pulled off, I think it's an amazing model for the rest of the world to actually follow. So to come to, you know, sort of your challenges, which are actually opportunities, Dr. Bhushan, I am going to ask you the question that everyone wants to know, which is, you know, how do you see, I mean, when you came in, there was a format or a plan for Ayushman Bharat. How do you see the landscape of healthcare delivery of Ayushman Bharat changing in India in the light of COVID-19 and and what it has taught us?
You know, Naina, COVID has changed our lives in a big way already. We can see it all around, not only health sector, but the way government functions, the way we are doing all these conferences. We could have thought of this even 6 months ago, right? And I've lived through SARS. When SARS was happening, I was head of the health sector in ADB. And I've seen the changes that have happened in countries where SARS really was a major problem, that is East Asian countries. And when I joined ADB, you know, I was told that I have to go to Sri Lanka and I have to convince Sri Lankan government that they should take loan or ADB loan for the health sector. And I was in this team and I was put in front of the finance minister. And I thought I made a very persuasive case to the finance minister that health should be seen as an investment, not as a welfare issue. And any dollar that you spend in health will give this much return, which is much more than any other investment you can think of. And the minister smiled and he told me in a very calm manner that, Mr. Bhushan, this is not how we invest things. We need hard money, which is you are giving loans, hard money for hard sectors, and we need soft money for soft sectors. And so if you have any grants, you talk to us. Of course, ADB didn't have a grant, so we didn't have any business in Sri Lanka. Same thing, I went to Vietnam, we got the same answer. But after SARS, all these countries were actually coming and knocking at our door that can we have more projects from ADB, loan project, because they wanted to invest more in the health sector. And not only the government changed, the health sector itself changed in many of those countries. And we are seeing the impact of that now because, you know, this virus, this pandemic has started from South China, but all the countries which are close to South China, Vietnam, Cambodia, Laos, Thailand, and also other countries, Taiwan, they have not been impacted that much, both in terms of number of cases and number of deaths. And that is because they had taken action that if a similar pandemic or epidemic comes, they will be prepared. So same thing is going to happen in India and all other countries, because now all the policymakers and everyone who matters in the government has realized the importance of health. Health is not a subject which is one of those social issues which are good to have, but not we shouldn't be investing. In the beginning, you mentioned that we are investing only 1.2% of GDP in health, which is one of the lowest in the world. And of course, after this is set to change, because policymakers, including our Prime Minister, has agreed, has seen that we need to have greater investment in health, both for public health, for preventive health, strengthening our capacity for testing, but also for cure, because we've seen that our big burden of non-communicable diseases has been a factor that people with comorbidities are at greater risk of dying, and also they need inpatient care. And in some places, although I must say that we have done really well, but our health system was getting overwhelmed. And this whole pandemic is still has not finished. We may still be seeing increase in cases. There may be a surge. So lot of change, things are going to change in the sector, in the health sector. Of course, also outside the sector, the way we relate to each other, many other things will change. But coming to health sector and PMJ, I believe that some things like we are going to be putting greater emphasis on IPC, this infection prevention and control, because as you would recall that earlier, when we were growing up, we used to have those injections which were reusable, but once HIV/AIDS came, no hospital has reusable injections. We have disposable injections. Similarly, now I would see that this use of PPEs is here to stay. Use of greater and more effective infection prevention and control measures in hospitals are here to stay. So is the telemedicine and other digital health work that we're doing. So all these things will come. At the same time, greater investment in the health sector, greater maybe support for investment in tier 2 and tier 3 cities, because we've also seen that not only we are spending too little, there is inequity and also variance in terms of how those facilities are spread. And also there will be a greater emphasis on demand side financing and the work that we're doing, say in Ayushman Bharat. And in Ayushman Bharat also, we'll have to see how to respond to all these changes that are going to happen. And right now we are I must admit, in a reactive mode, trying to react to the crisis, but we need to sit down, take stock of things and see what kind of changes we should be bringing in the scheme to respond to this, and also preparing ourselves for better coming out stronger from this crisis, so that in any future crisis we are better prepared.
Thank you. When you put it out that way, it was so clear, when you talked about the countries around Southeast Asia, and I'm based in Singapore, and exactly what you have said makes so much sense as to how these countries really learned from the SARS experience and actually invested, and therefore have come out of this crisis much more lightly than a lot of their other counterparts. And I think, for everyone hearing and listening, I think, the importance of investing in prevention, along with, of course, investing in cure, is it couldn't be clearer than the examples that you actually presented. So thank you so much for that, Dr. Bhushan. I'm going to move for a second to Mr. Kagan. Dr. Bhushan talked a lot, and I think that's very important, about ramping up the amount of investment India makes in healthcare, and how it is very important for it to not really be seen as a soft subject, or something that is only open for philanthropy. So I'd love for you to talk to us about the work that USAID and other US government agencies have been doing and are doing to improve health outcomes in India. How do you feel that supports the United States-India strategic partnership, which is growing stronger every day? And how have you seen the COVID-19 pandemic affect any of that? I know there are 3 questions in that one question. I kind of slid them in, but over to you, Mr. Kagan.
Thank you. No, I mean, I think that the first is that the U.S. has been involved in supporting India's healthcare sector in one way or another for over 70 years. The U.S. has been an assistance, has been providing assistance and supporting India's development since India's independence. And I think that, from our standpoint, we've always felt that healthcare was a very important thing to invest in. Now, the type of investment has evolved, and I think that the relationship has evolved, and now it's very much a peer-to-peer partnership. One of the things that's been very impressive to me during this sort of COVID-19 crisis is the degree of interaction that we have in so many different areas. I mean, ranging from USAID, which has been involved in supporting a very wide variety of fields, ranging from, dealing with maternal and child welfare, in fighting infant mortality, providing direct support to the medical system. But also, we have agencies of our Department of Health and Human Services, including the Centers for Disease Control, the National Institutes of Health, the Food and Drug Administration, who have very extensive partnerships that have been built up over a long period of time. And what's very interesting for the HHS is that a lot of those partnerships are doing cutting-edge research, where you have world-class Indian researchers working with their American counterparts on issues that are important for both countries. So I think that one of the things that's been very nice to see is that the relationships that have been built up over the years in those areas have really paid off now. I think CDC in particular has been very active in providing support to their Indian counterparts, and some of what we've learned in India has actually been very useful to us in the United States. So I think it's a very symbiotic relationship. Our Indian counterparts span the entire gamut of government, and I think that what we have seen is that there has been a tremendous desire over the years to change the terms of the partnership to one where we're providing niche support in areas that help unlock capacity on the Indian side. I think that one thing for USAID is just worth noting that the USAID health programs are estimated to prevent up to 2 million deaths per year, which is a remarkable number that I think has tremendous benefits for India. I think it's also worth highlighting that we see the work that we're doing now, including on trying to take what we've learned from dealing with COVID, as well as the research that's being done in a number of areas in vaccine prevention and others, or vaccine development, is something I think will strengthen the relationship. At the same time, let's be honest, there are tremendous challenges. In every country in the world, people are turning inwards because every country is facing tremendous public health challenges. And it's much harder to think about working with others when you're trying to manage your own challenges. I think what's very positive about the US-India relationship right now, and I think what fits into your question about the strategic partnership, is that both the US and India have tried to prioritize working with each other. And so each country has sought to make sure that items that were critical for the other country were made available. And I think that that's built a tremendous amount of trust. So overall, I think that we're not out of the woods, and I get nervous when we talk about the second wave, because the truth is I don't think we're really out of the first wave. And I think that the experiences that we've had also highlight that some of the things that we need to be working on are building capacity in the private sector. And also dealing with non-communicable diseases. The truth is a lot of government public health investment over the years has been really focused on infant and child mortality, and also vaccinations and communicable diseases. But what we're seeing is that having a very heavy load of non-communicable diseases has a tremendous impact now because of the relationship and the vulnerabilities caused by COVID. So I think overall I'm optimistic. I think that, what we see is the US and India recognize that we are good partners to each other, and the relationships we've built have been useful. That isn't to say that there aren't real challenges, but I think that we have the sort of the legacy relationships that allow us to manage them.
Thank you. No, I think you raised some very, very interesting points there. In firstly, where I think it's also interesting to note that the relationship has evolved between the United States and India to being much more of a symbiotic relationship, more of peer-to-peer sharing and learning and research. But it is also where we are receiving niche support from the United States, and it's important to see that. You also talked about, and so did Dr. Bhushan, about the focus on communicable diseases in the past, but the importance of looking at non-communicable diseases, especially in the light of where the vulnerability in that population with respect to the pandemic. So I'm going to ask Dr. Bhushan a question around that line, where looking at health service delivery, in the future, post-pandemic, looking at the fact that India has such a high number of non-communicable diseases, a population of non-communicable diseases, what are you thinking? And especially, if you use your background at the ADB, how do you think private sector finance, or looking at any kind of sort of blended financing mechanisms, whether they are loans, whether they are investments, how do you think they could actually help us going forward in terms of health service delivery?
Nana, very good question. Let me just de-jargonize a few words. So what is
Sure.
blended finance?
Yeah.
Because of course, there are several names for blended finance. But why do we need blended finance? What it is? So as you mentioned that right now we need a large amount of investment in private sector.
Mm-hmm.
Of course, public sector will keep its prominent role in terms of providing services, primary healthcare, regulations, and maybe providing these centers of excellence like AIMS. But bulk of services are coming from the private sector and would need to come from private sector, because government will never be able to fill that gap. So now, if we are asking for investment in healthcare from private sector, we have to see whether they have the requisite return from the investment they can make, especially in tier 2 and tier 3 cities. So the idea is that is it worthwhile for them to make that investment? So we know for sure that investment in healthcare, it has a longer gestation period. The returns come not just tomorrow, day after tomorrow, but it takes a long time, because like any other infrastructure project, the payoff period is long. Second thing is that it's high risk, that maybe you put an investment and later on regulations change or demand changes or something else happens, like COVID happened and any shock, and then maybe those returns that you expect are not certain by any chance. Therefore, one has to de-risk the investment, and someone else has to share the risk. And that's where the blended finance comes. And blended finance can have many forms. One normal form could be that it's a support for, say, equity investment. You are putting an investment for, say, $100 million, and we are saying, okay, out of those $100 million, we can give you $80 million as a loan, and 20 million will be our equity, and we are in it with you, and we are sharing the risk, and of course the gains, whatever comes on later. By putting our skin in the game, we are with you and supporting this. Or other form could be that instead of giving you market rate in terms of interest, we'll give you a discount of, say, 1%, 2%, so that it's much more viable. Other could be that we give you this much grant, this much loan. So there is different combination where you can have a blended finance, and it would be needed because we know that health sector is not health sector is a risky sector, and the payoffs may not be high. In some cases, there may be some public health elements where there are a lot of externalities where a lot of services are going to be provided but not being paid for, so they're not commercially viable. And in some cases, the payoffs will come much later, and those payoffs are also uncertain. So we need these innovative de-risking investments where we can attract private sector financing, and that will be needed. And I'm very glad that we are working on the same concept together with the USAID and other development partners for attracting greater investment in tier 2 and tier 3 cities.
No, thank you. And, I completely agree with you. And also thank you for breaking down, the jargon of blended finance, especially for a lot of people that are on this webinar, because I completely agree. And, one of the things that AVPN has talked a lot about is this whole continuum of capital. So how do you use philanthropic capital or patient capital to take the first loss, to actually de-risk the investment? So, exactly what you talked about is that one cannot always estimate that, you're going to make a profit or you're going to make a positive return on your investment from day one. So how can we actually bring in different pools of capital to actually have the impact both from a social perspective, but also from a market perspective? You'd mentioned, Dr. Bhushan, about, the initiatives that USAID has also been involved in around innovative finance. So I'm going to go with that to Mr. Kagan to ask you, given the context that, that Dr. Bhushan shared about the role that innovative social finance can play to address these various healthcare challenges. Can you talk a little bit about those and tell us how USAID is using these financial instruments to support the NHA in serving India's most vulnerable, and especially in tier 2 and tier 3 cities?
Sure. A couple of things. I mean, first of all, I think that's one of the things I've found the most interesting in my time in India is seeing how innovative financing has been both developed here and also the potential that it has. And I think that what we see in the healthcare sector, but I think particularly at the time of COVID, is this extraordinary need for capital. And that's true in many other sectors in India. But I think that right now, because of the large role that the private sector plays in healthcare in India, and the hits that the private sector is taking with essentially significant decreases in revenue due to the impacts of COVID, while at the same time the challenges of dealing with COVID itself in terms of additional costs, all sorts of stresses on the system, I think creates an even greater need for capital, in part to address the things that Dr. Bhushan has talked about, particularly in tier 2 and tier 3 cities. So I think that the AID model on this, and I would just say as an aside, it is rare that government is accused of being innovative, and particularly the US government. And I think that one of the things that's really exciting about what USAID is doing is that they have very much focused on innovative financing as a way to try and unlock much greater investment in critical sectors in India. And so I'm very impressed with my USAID colleagues because, as you know, trying to do something new in any organization is tough. Doing it in government, in the US government, is particularly difficult. And so what we're working on and what they've worked on is essentially a model where, as you mentioned, the de-risking. So essentially, they're putting together money which then unlocks private sector or, quasi-private money to do it. So essentially, they're working through this PAHEL mechanism, which essentially they're getting $3 million from USAID money and a couple other donors, which then helps to de-risk the investments that will be made by investors. I mean, be they private sector, be they foundations. And so the original goal was to try and unlock $50 million. I think now we're getting a little bit more optimistic and thinking we can unlock more with that. And so the idea is that this essentially provides loan guarantees which reduce the risk so that you can unlock private sector or foundation capital to do investments which increase capacity in areas that need it. And so the key partner here is the National Health Authority and Dr. Bhushan, which essentially helps underwrite the return on these by doing payments that they were going to do anyway. So I think that what's innovative about this is trying to put all the pieces together, trying to use the very innovative Indian government model of Ayushman Bharat and the National Health Authority, link that with the fact that there is philanthropic capital that is available, and trying to link it to private sector capital so that we're able to get market returns or close to market returns for investors. Now, obviously, this is sort of the holy grail. If you can pull this off, then the ideal is in the long term, then the seed money from government becomes less important. And ideally, this can become self-sustaining. But I think that even if it can't, the key is to think that we have a certain amount of money that we have available through USAID. Instead of putting that money directly to the healthcare sector and the traditional model that development agencies use, we are using it to provide loan guarantees, which then unlock a far greater amount of private sector capital and allow private investors to get market returns. So, it's still early days. I would note that USAID has worked on 2 other projects, the Utkrisht Development Impact Bond, which was the first development impact bond that specifically targeted maternal and newborn health, as well as the Mukti Pay for Performance model, which focuses on treatment of TB. And so there is experience in this. And look, you want to be very careful of being too optimistic. And I'm sure, Dr. Bhushan, when you do things at scale, you also get headaches at scale. Here, we're doing things at slightly lower, smaller levels. So, our mistakes will be smaller if this doesn't work. But I think that the potential, if it does work, is extraordinary. And in my mind, there are extraordinary needs. There's an extraordinary crisis. And so, we need to be thinking big. And this model, if it works, has the potential to be scaled. So I'm very optimistic. Inevitably, there will be things that we will learn. Like when we do the second one, I'm sure we will do things differently because we'll try and make new mistakes and not repeat the same mistakes of the past. But I think that this is driven by a desire to innovate in terms of addressing really critical needs that will make a huge difference for India. And if the model works here, I think it can be taken other places, because if you can show that you can do this in India, you can do this anywhere.
Absolutely. If you can do it in India, you can do it anywhere. I have heard that before about, pretty much every sector, and definitely holds true on the healthcare sector. Lots of very nice sort of points that I'm going to use, Mr. Kagan, and I'll give you credit for them. Headache at scale. Very, very, another one that is one for a quotable quote. We are coming quickly to the end of our hour, and I want to make sure we have some time to actually take the audience questions, and I can see that we have a lot of audience questions. So while we're compiling the audience questions, I'm going to ask Dr. Bhushan to close with some, just tell us a little bit about the key initiatives that the NHA is taking to address the challenge at hand. We have, a lot of people who are interested in knowing that.
No, it's a good question, and there would be a long answer, but given the time, I'll just focus on a few things. But I tend to agree with what Mr. Kagan mentioned, because I was told when I was driving that if you can drive in India, you can drive anywhere in the world. And there is a lot of things going on. Our major focus right now is to ensure that for COVID, no one who wants to get treated or tested should not be denied because of the financial risks. So we have included, of course, packages for this, and a number of cases that we're supporting through Ayushman Bharat for testing and treatment are quite large now, and we are focusing on that. But actually, more than COVID, actually, we are worried about non-COVID, because what has happened is that in last about 4 to 5 months, the number of non-COVID cases have gone down. And actually, during the lockdown, they had gone down by about 50%, actually, in some cases, more than 50%. And it was a key issue for concern for us because many of them are critical cases. They need dialysis, they need chemotherapy, and they need other critical care, and they were not able to get that. So ensuring that everyone who needs critical care, and I'm talking about non-COVID, gets it. And so we are focusing on that. And one of the things that we're finding is that supply of hospitals has shrunk because many hospitals have closed down and many have scaled back the operations. So we are trying to impanel more hospitals. In last 3 months, actually, during the lockdown, we impaneled about 1,500 more hospitals, new hospitals, so that we can increase the supply. We are also going out and trying to impanel labs, because earlier we were impaneling only hospitals. Now we are impaneling labs so that we can provide those kind of services. So ensuring that everyone who is our beneficiary receives care. And so far we were worried only about the financial constraint. Now there's a supply constraint as well. And looking at that is a major issue in the short run, but also in the long run, because we are finding that many of the hospitals, private hospitals, need injection of cash because they are running out of capital. They are running out of running capital, and they would need some support. So we'll have to work with them and different departments and ministries in the government to see how we can bring them back in fold, and so that they can start to provide those services.
No, thank you. And, we, in this last 3 months, we sort of seem to forget that there is a world that exists beyond COVID. And, there are huge social issues that are not COVID related. And, thank you so much for bringing our attention back to the fact that, while COVID is phasing, there are still other critical diseases that are also still very much present in our society and amongst our people. So thank you for that. Finally, in closing, Mr. Kagan, what I will ask you is, what is the role do you see for development partners like AID in promoting the adoption and the scale up of innovation in countries like India, in a country like India, where it is possible to really see scale and actually reap market benefits? And while you're closing, I'm going to be getting all our questions together. So I will be asking both of you questions from the audience after this.
Yeah, I think it's a good question. It's one we ask ourselves because obviously, one of the challenges, and Dr. Bhushan referred to this, is how you manage on the short-term demands of a crisis with thinking longer term about where are we going to be in 6 months, a year, 5 years. And so I think that, what we see is that ultimately this is about partnership. This is about working with our Indian partners who we have developed over a very long period of time in a wide variety of areas. I mean, CDC's partners, US CDC's partners are very different than USAID's partners in some areas, and they're doing different things, and all of them are important. And trying to work on the research piece, which the National Institutes of Health as well as CDC are very, very involved with, because ultimately, this is something that is building for the future. And looking to make sure that we are being as creative as possible. And as I said before, that's not always easy for governments. And I think that I'm incredibly proud of my USAID colleagues because it is the fact that they started working on this innovative financing and took this on as part of their portfolio and something to particularly focus on in India. The fact that they did this in previous years gives us the ability to try and respond today. And so part of what our goal should be is making sure that we're continuing to do the same thing in terms of building for the future and thinking for the longer term now, rather than just thinking about how do we respond to this immediate crisis. So I think that, I see innovative financing as something where it's incredibly valuable to bring different people together. Inevitably, we're not always going to agree. And I think that the challenge of how you square the circle behind how the public sector operates, the needs, and the systems, and how investors look at things is a challenge. But what we've seen, and not just in India, is that when you can do that, you can unlock tremendous amounts of capital, but also change the paradigm. I mean, the truth is, Dr. Bhushan referred to the headaches he has dealing with all the different states. But one of the benefits that you also have is that you have a lot of different models, and inevitably some will work better than others. And ideally, over time, what we can all do is cherry pick the things that work the best in each of our areas and try and bring them together. And I think that's one of the benefits of being in on the ground floor on innovative financing, is that no one really has broken the code on this. And as we try and expand it to other areas, it forces people to work together in ways that you don't when someone has a model and it's this model, or else we're not playing. I think we're all entering this with the idea that we have to look for ideas and we have to work together. And I think that is actually a strength for the United States. We have historically been able to develop these partnerships in India. And hopefully we can keep doing that. And that's why, being willing to make mistakes, being willing to come in and say, look, we don't necessarily have the solution, but we want to be part of the challenge of addressing this problem, I think is the way to go. And so hopefully what will come out of this is people, when they're, writing, the histories of all this, they will say that in the same way that Dr. Bhushan and we all referred to what was built at the time of SARS, the immediate aftermath of SARS, hopefully 20 years from now, people will be saying the same thing about what we've done now and what we're going to be doing in the next couple of years. So I think that's our role, and that's certainly what we hope to be able to accomplish.
Oh, absolutely. Let's be prepared for the future and look beyond the immediate crisis. I'm going to, we have, I think, more than 20 questions, and I have only 9 more minutes. So I have the wonderful task of picking which questions I'm going to ask. So there are a lot of questions around social finance. So Dr. Bhushan, one of the questions that has actually come to you is that if we think that the bulk of health services if the bulk of financing of the health services has to come from the private sector, how can blended finance be used for making it affordable for excluded and disadvantaged populations? I think you addressed a little bit of it when you talked about de-risking it, but the question is, how do we make sure that if private sector is funding the bulk of health services, how will it be affordable for the excluded and disadvantaged population?
Yeah, Nana, so one of the criticism of the private sector is that they're looking for profits, and so they're looking for only the creamy layer, the cherry picking. And that's where I think the schemes like Ayushman Bharat have come in play, that they're providing the same benefits or the same use of services and same quality of services as a paying person would get and should get. So right now, I spoke earlier that we have used about $2 billion. And out of that, about 60% actually has gone to the private sector, where private sector has provided those services to poor and disadvantaged. So in a health financing system, when we see, so we have to make sure that public sector, of course, is catering to everyone, poor or rich, but private sector also should be supporting the poor and the vulnerable and the disadvantaged. And that's where the demand side financing through Ayushman Bharat comes in. So we are now constrained that in tier 2, tier 3 cities, there aren't enough hospitals, and that's where most of the poor people live. So we are promoting investment in health sector in these underserved areas, so that people have services where they live, and they're funded by government schemes like Ayushman Bharat.
Thank you. A question for you, Mr. Kagan. How can, I guess this is from your experience of being in all these different countries. In your opinion, how can India lead the world in terms of innovative social finance and venture philanthropy? Very easy question. So,
yeah, look, I'm the first to admit I am not an expert in this. I'm passionate about it because I think it has tremendous potential. But I think that we're still trying to figure out different models that work. I think that development impact bonds offer one model. I think that what's being done now with the blended finance facility offers another model and I think that, you know, the key is trying out these models and then being relatively quick to, you know, cast aside the ones that don't work. And I think this is look, let's be very honest, it's a challenge for all of us in government, because none of us like to admit things don't work, because then we're going to be slammed by the press and by other people, you know, for why'd you waste this money? But inevitably, when you're trying new things, not everything's going to work equally well. And I think that, you know, so what I see India offering is a combination of a lot of incredibly talented people who are doing very innovative things. Tremendous needs. I mean, let's be very candid. There are huge needs in a variety of different sectors, probably nowhere greater than healthcare, but there's a lot of other areas as well. And so that you've got a combination of talent, you've a combination of needs, and what we need to do is try and make sure that there's the capital. And, you know, in general, across almost every area of India's economy, capital is a constraint. So, you know, in the social sector and public health, other things that are linked to, you know, what Dr. Bhushan is what's called the soft side, that, you know, what we want to try and do is unlock capital that addresses that to strengthen India's development. And that will, at the same time, provide returns to the investors. So I think the key is being willing to try new things, recognizing that we're going to make mistakes, and so we don't want to always feel we have to double down on things that don't work because we can't admit they don't work. So being quick to sort of assess the results, and then being quick to try and bring things to scale once we find things that do work. And I think that the healthcare is particularly valuable because, again, by creating Ayushman Bharat, India has created a mechanism that basically will reimburse the private sector. That is a tremendous development. And because, as Dr. Bhushan said, the private sector provides so much of the care that essentially offers a vehicle for unlocking it. So now what we need to do is expand the capacity. And that is something that is a classic investment challenge. You basically, there's a huge demand, there's a lack of capacity. Building additional capacity costs X amount of money. The potential returns, which are essentially set by the reimbursement rates that Ayushman Bharat has, are calculable. And, you know, look, many people on this call are brilliant financial people who make their, you know, make their money by figuring out how you create the arbitrage that makes this kind of investment worthwhile. Our job is to try and make sure that we're creating the right conditions, and particularly at the beginning, to try and reduce the risk so that people are willing to try it, because it's very hard to get people to be the first into something new like this.
No, thank you. Unfortunately, we are really running out of time, so I'm not going to take any more questions. I think, you know, firstly, I want to thank both of you for some really remarkable insights. I think, you know, it's clear that, you know, there's a lot of learning. It's also clear in terms of the kind of opportunity that exists in the healthcare sector for private sector investors to come in, provided, of course, that they are willing to take a risk. They are willing to accept the fact that, you know, it's not every investment is going to be successful. Partnering with Ayushman Bharat or, you know, with the NHA to de-risk some of these investments is something that is an available opportunity. We can learn from some of the innovative business models that USAID through its PAHAL program has actually put forth, and there is learning. And, you know, as Mr. Kagan said, these are small scale pilots, and it's good to, if you have to fail small, and if you succeed, then to really go out there and scale it up. And India obviously has the market to scale it up. I think one of the things I've taken away from this is that, you know, if we can use this crisis to actually look at investing in our healthcare sector to be much more prepared going forward, I think we would have done very well. Once again, I want to thank both my panelists for joining us and you know, giving us your valuable time, especially you, Dr. Bhushan, for taking the time out in what I'm sure is a very, very busy day. And you, Mr. Kagan, as well, for taking the time to speak with us. Thank you so much. This webinar has been recorded. If you would like to download it, you will find it on the AVPN website. If you want to know more about AVPN USAID PEHEL partnership, you can also log on to our AVPN website and learn more about that partnership. Once again, thank you so much for joining us. I hope you have a very good afternoon or evening, depending on where you've joined us from the world.